consistency of that student coming out of CFI is better than I think you'll find anywhere in the workplace.
CFI graduate skills are exceptional. I think the CFI gives excellent training and then teaching students, and when they graduate they have the basic skills and you still need to train them a little bit to meet your needs. So that's what we try to do for at least a month or 2 months. We try to train them to meet our needs.
So the platform that you provide and the background and the associate's degree that you give them allows them to go on much, much further in their education process.
Most of our students that we've hired, they'll finish their externship on Friday, and come Monday morning, we've already put them to work. They've gone through the orientation, the hiring process ahead of time. Monday, they're no longer a student, they're an employee of ours.
We have been involved with CFI for several years now, and we have hired several of their students.
The platform you provide for them is a great platform because you give them the training and the basics that they need to go on from there. We're basically a learning center for these people because they haven't had a lot of ophthalmology training. They've had such a great general background in sterile technique, how to actually handle the surgeon and how to respond to the surgeon and the surgeon's needs. And they don't take things personally. I've had times in working with different scrub techs in the past who you say something, well, why'd you do that? And they just break down. They'll cry or whatever. They're not professional. And I like the fact that if I criticize them and I say in a manner that's constructive, they take it in a manner that's constructive. They don't take it personally and they say, oh yes sir, I understand, I'll be able to do that from now on. Thank you very much. If something's not going perfectly well during a case, they say a machine could, have a failure and the surgeon could get upset. They're going to handle it in stride. I'm not going to worry about the surgical tech. Okay, I've had to do that, but with your graduates, they seem to just handle the surgeon well as the patient and their duties and responsibilities. They can become whatever they want after going through your program. And frankly, basically their skill level so high that the training involved to get them up to speed is a real short term. So there's an incredibly broad field. So any time they want to enter the field, to just start in an institute like yours is a great place to start. They get a degree and it's in the health field, and there's a whole new world that opens up.
I'm very pleased with CFI graduates so far. They do have basic knowledge about their job, and with some training we provide in our office, they're able to meet the day-to-day challenges in our office. They have training for the front office and back office, which is very important. So most of the graduates we hire are able to do front and back office skills. For our office, I think we basically would like them to do front and back office, and most of these graduates are able to do that. And also they do externships in doctor's offices when they're in training. I think that helps them a lot to prepare for their work experience. I hired a first graduate about 6 to 7 years ago, and I really got impressed by the way that she has worked in the past, and she worked for me full time, and she was really very helpful. I've been trying to reach CFI since then. If I need someone to be hired, I'm not looking anywhere else.
We started using CFI students. I often had positions open for more than a year because I couldn't find a qualified practitioner. And now I have a resource, and I've got most of my positions filled. Well, the job market has contracted a little bit. But the CFI graduate, because they are credentialed, has a special niche that they can fill. They also can pass their professional exam the first time around, which means there's no delay or very little delay between the point that they graduate from school and can walk in as a credentialed practitioner.
The graduates that we have now, we actually had them as students. So we had them for 6 months. We trained them hands-on. They were able to sit for the registry prior to graduating because CFI has maintained their accreditation. Therefore, those candidates we're going to put in front of anybody else. They have done a great job here in purchasing equipment that you would see in a physician's office today. The students are in the lab often, hands-on, scanning with the instructors right there aiding them. So when they come in, they've had that hands-on application. You can't reproduce that.
CFI provides an excellent knowledge base and skill level for their students, which enables them to enter the medical field and adapt quickly to the clinical setting. The CFI students definitely come with a high level of skill and a huge knowledge base, which then we like to take in turn and have them grow from that point. That also helps in the training process, which makes it seamless from going from student to healthcare worker. We've hired several CFI students over the past 6 years. They demonstrated great work ethic, a desire to learn. In cardiology, it's a never-ending learning. You're forever the student. The reputation of CFI is an excellent one. We've been very successful in our affiliation with their program and hiring their students and the continuing externship programs that we hold at All Children's Hospital. We've had wonderful success. They have top-notch students here.
We've had a relationship with CFI for several years. We use them in their externships with the hopes to hire afterwards. CFI graduates, if they've worked in our facility, they can start working as a full-time employee the day they graduate. They seem to fit in really well. They have great education and professionalism. And we've hired probably between 8 to 10 of your students over the last 10 years.
When I walked into my job, I can do everything because I remembered everything from what I learned here. As my front office class taught me everything that I need to know about front office. Filing, I can remember everything because I do it now, so I adapted very quickly. Hands-on training was probably the best because you go to some schools, you don't get hands-on training. They like to give you classes and then you go out. But the hands-on training was probably the best part because you got to actually draw people's blood, not get pushed out into a field and do it for the first time on a patient. You got to do it here, or like learn how to do blood pressures here. Everything was learned here, so it's much better than just online classes. It was a lot of help for me personally. I would tell them how I felt about it, how I felt when I came in, how everybody was warm and nice and welcoming, the hands-on experience, the teachers, how they helped me find a job afterwards, everything. I've had the best experience here. Then I can say it. I've actually told a couple friends about this place already, and some of them actually are enrolled and go to school now.